Assalamu alaikum guys, welcome back to my YouTube channel. Alpha receptors, beta receptors, muscarinic receptors. These are the three receptors that are present in the eyes, but we always get them confused and we don't know which receptor does what. So today I'm going to make it easier for you. I'm going to tell you the location of these receptors in the eye, and we're going to discuss about the various drops or the various medicines that can be given in various diseases, and to use these receptors we can help the person get rid of the disease. So let's discuss alpha receptor first. Alpha receptors in the eyes is alpha 1 and alpha 2. Alpha 1 receptor is present on the dilator pupillae muscle of the iris. That are the radial muscles of the iris that are responsible for dilation of the pupil. So alpha 1 agonists, that means the medications that result in the adrenergic activation of alpha 1 agonist will result in mydriasis, that is the dilation of the pupil. But at the same time it will cause an increase in intraocular pressure, which is an unwanted side effect. Examples include phenylephrine. Alpha 2 receptors are present on the ciliary epithelium, and their agonists cause decrease in the intraocular pressure, and by increasing the UV scleral outflow they also decrease the intraocular pressure. And their examples include brominidine, apraclonidine. Now let's come to the muscarinic receptors. Now in eye, the M3 receptors are present, and that are present on the sphincter pupillae muscle. These are the circular muscle of the iris. Now in normal conditions, these agonists, the M3 agonist, results in the constriction of the pupil. So if you have a disease like glaucoma and where there's increased intraocular pressure, so we can give drugs like pilocarpine or carbachol if the pilocarpine is contraindicated due to any reason. This will result in the decrease or the smaller size of the pupil, and as a result the trabecular meshwork where the intraocular fluid is drained, that will get widened, so the fluid will easily get drained from here. Now on the other hand, we can use the same M3 receptor antagonist to dilate the pupil, such as in cases of surgery, phacoemulsification, or you want to look at the eye in a slit lamp examination. So we use M3 receptor antagonists, and their examples are tropicamide. It's a fairly well known mydriatic worldwide. Now let's come to the beta receptors. Now the beta receptors are beta 1 and beta 2 present in the ciliary epithelium and the ciliary muscle respectively. Beta 1 is present on the ciliary epithelium. Beta 2 is present on the ciliary muscle. Now remember, ciliary epithelium is responsible for the production of the intraocular fluid. Now these receptors, beta blocker, the beta receptors, we can block them, and this will result in decrease in the intraocular fluid. Examples include timolol, betaxolol. But remember, their use is avoided during bedtime because at night the blood pressure is reduced further. This can result in a decreased perfusion of the retinal arteries, which can result in unwanted or visual field defect problems. Now, having discussed the beta blockers, remember, beta adrenergic agonists also play a role in the intraocular pressure decrease. Now how is that? Remember, beta adrenergic agonists can also be given in diseases such as glaucoma. Why? Now, the reason is they increase the aqueous outflow, and as a result they cause a decrease in the intraocular pressure. Now I know this sounds so confusing that you can give either beta adrenergic agonists or beta blockers, but if I give you a case, let's say a patient who is asthmatic, he has pulmonary disease. Now in that case you cannot give beta blockers, so you can go for beta adrenergic agonists, because beta adrenergic agonists will not deteriorate his already pre-existing lung conditions such as asthma. But if you give beta blocker to a patient, that same patient, this will result in the exacerbation of asthma. So in order to avoid that effect, that unwanted effect, we go for beta adrenergic agonists in these patients. Now examples include epinephrine, fairly well common, worldwide used. Dipivefrin, another example. One thing I would like to add, prostaglandins are another class of drugs that can also reduce the intraocular pressure. Now if I give you two choices, timolol and latanoprost in MCQs, which will you go for? Remember, when these two options are given, you should go for latanoprost. It has more effect, it decreases intraocular pressure more effectively than timolol. So in these two cases you should go for latanoprost. Apart from that, there are other drugs that causes mydriasis such as cyclopentolate and atropine, but these are usually used in children because cyclopentolate and atropine also causes cycloplegia. Now, cycloplegia is basically the paralysis of the ciliary muscle. Remember, if we want to test the refractive power in children, we want to remove the accommodative power factor from them, because children, they don't understand your language, so they will use their accommodative power, which is fairly strong in them. So in order to remove that factor and get the refractive error, we use these drops, and this will cause the accommodative power vision loss, and they will have problem for 2 to 3 days, but you will get the exact measurement, the refractive power, and you can make the required spectacles for them. I hope you got a brief idea about the receptors that are present in the eye, the drugs that can be used to relieve from various diseases. If you think I can improve my videos, please leave it in the comment box, and I will try to read them and improve my upcoming videos. Until my next video, guys, take care of yourself.